Welcome to the Slop Farm. Enjoy the video.
You begin by confirming eligibility. Book a clinic or teleconsult with a licensed provider so you get the right prescription. Once done, tell the clinician about allergies, current medicines, blood pressure, and whether you are breastfeeding. These details determine combined versus progestin-only pills. Make sure to obtain a supply and read the leaflet. You will learn when to start. First day, Sunday start, or quick start. Follow the provider's instruction so protection begins correctly. You take one pill daily at the same time. This keeps hormone levels steady and reduces failure. For combined pills, follow your pack schedule, commonly 21 active then 7 inactive, or 24 active then 4 inactive, while progestin-only pills are taken continuously every day with no hormone-free interval. Once you decide to switch brands or methods, follow the provider's overlap or immediate switch instructions to avoid gaps. Make sure to use condoms for 7 days after starting, unless you maintain protection by taking pills daily and renewing prescriptions before they run out. If you miss one combined pill, take it as soon as you remember and continue. If you miss 2 or more, follow the pack's emergency instructions and use backup contraception for 7 days, or consider emergency contraception if unprotected sex occurred. If a progestin-only pill is over 3 hours late, use backup for 48 hours. Make sure to report severe side effects and check drug interactions with your provider.
Thanks for watching. Consider subscribing if we helped you today.